Hello friends. So today's topic of discussion is stethoscope. Stethoscope, its parts and their function. So we call it as anatomy of stethoscope. Why is this topic important? See, this might not come in your exam and obviously not in the theory, definitely. But this is something that the examiner is or might ask you during the practical exams. So this is something you need to know. So as you can see, we have a picture of stethoscope here. So let's start with the chest piece. So what is the chest piece? Chest piece is the part that you keep on the chest of the patient. So let's see it along with an actual stethoscope. So you can see this is the stethoscope that we use. So this part is the chest piece. Now, as you can see, this chest piece, see in the diagram, this wider part, this is called as the diaphragm. You can see there is this surface over here. So this is the diaphragm. Now the smaller diameter, this part is called as the bell. This has a slight hollow area within itself. Okay, so this is how you differentiate. This has a flat surface, the diaphragm, and this has a hollow surface, this is the bell. You can see a very small hole here. This is the acoustic hole through which the sound waves go inside when you're taking it from the bell side. Okay. Now, what is the part that is connecting these two parts? Here, this is called as the drum. Okay. Now, this is the chest piece what we saw. And here is the acoustic valve system. So if you've seen a stethoscope, you can see, you know that this is what turns around. And what happens when it turns around? When you tick on the diaphragm, you can hear the sound when it's on the on position, and you cannot hear it when it is in the off position. So you know accordingly where to switch it, which side to switch it on. Okay. Now, having said that, why do we need these two parts? This was enough. Usually in the clinics and the hospitals, we see that the doctor is seeing through this part itself. So this is for higher frequencies. What are your higher frequencies? Your normal heart sound and your normal breath sounds. That is your higher frequency sounds, which is transmitted through the diaphragm and taken forward towards the earpiece. Okay. On the other hand, bell, let's remember it like this. This has a larger diameter, this has a smaller diameter. This is for higher frequency. So what is this for? This is for low frequency sounds. What are the low frequency sounds? The heart murmurs and the bowel sounds primarily. Okay. So if I ask you that which part of it will you use for a cardiac examination? Suppose you know that a patient is likely of having a cardiac pathology. Which side of the stethoscope are you going to use? The answer is both sides. Why? Because you want to see the normal heart sounds also, and you also want to check whether there are any heart murmurs or not. Okay. So this you have to remember. Now, having read the chest piece, now this is the tube. This is the PVC lining tube which is connecting this chest piece to this earpiece. Okay. Now, once it reaches here, you can see in the diagram, they are saying that this is binaural spring and this is the binaural. So, what is binaural? Bi means two and oral is something related to the hearing. Okay. So, this is leading towards your earpiece. So this is binaural. And why spring? When you stretch it like this, it comes back to its original position on its own. So we have a spring here. It has a spring mechanism, right? So this is the binaural spring and this is the binaural. What is it leading to? This is leading to the ear tips. So this is the ear tips which goes inside the ear of the listener. Okay. Now how does it goes inside? So you know what is the direction of your ear canal? You all know that it is medially and forward. How do you remember it? It is from ear to nose. Your nose with respect to your ear, it is medial and it is going forward. So that is the direction of your ear canal. Now whenever you are holding a stethoscope and you want to put it inside your ears, it has to go in that direction itself. Okay, medially and forward. So these are the parts of the stethoscope, and now you also know how to put it in your ears. Okay, thank you.